6 causes of bleeding after sexual intercourse. In this video, I'll be sharing with you the common causes of bleeding after sexual intercourse and when you should seek medical attention. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I'm a fertility physician and my channel focuses on everything infertility and women's health. So if this is the kind of content you're interested in, keep watching. So one of the common causes of bleeding after sexual intercourse is vaginal infections. For example, sexually transmitted infections like gonorrhea and chlamydia. These infections can cause inflammation and irritation in the vaginal area. When a woman gets infected with chlamydia, the chlamydia will get to the cervix, that is the neck of the womb, the neck of the uterus, where the baby comes out from. Now, when this chlamydia infection gets to the cervix becomes swollen, tender, and very delicate. It gets irritated. Sometimes during sexual intercourse, the penis pokes at the cervix, and because the cervix is already irritated, any small poking will cause it to bleed. And this bleeding can be in form of spotting or a slight pinkish discharge, or it can be a lot of reddish discharge. Not every woman with a sexually transmitted infection will experience bleeding after sexual intercourse, but this is one of the causes of bleeding after sexual intercourse. Pelvic inflammatory disease is when the infection has ascended. That is, it has traveled from your vagina to your cervix, to your uterus, and has gone all the way to your fallopian tubes. When this infection has gotten to the fallopian tube, it causes irritation of this fallopian tube. And by the time this irritation is healing, because there'll be inflammation and irritation, by the time it's healing, it will heal with scars. That is, it causes scarring of the fallopian tube. Pelvic inflammatory disease can cause painful sex and bleeding after sex. So if you suspect that you have a sexually transmitted infection or a PID, go and see your doctor immediately, because apart from bleeding after sex, STIs, that's sexually transmitted infections, and PIDs, that is pelvic inflammatory disease, can cause infertility. The second cause of bleeding after sex is vaginal dryness. Insufficient lubrication during sexual intercourse can lead to friction and irritation, and this can lead to tears and cuts, small tears and cuts, which can cause bleeding during sex and after sex, especially if this dryness is persistent. There are several things that can cause vaginal dryness. One is having sexual intercourse before being fully aroused, because when you're aroused, your body naturally makes the vaginal secretions that is necessary for lubrication during sexual intercourse. Another one is douching, that is putting chemicals or weird mixtures with a pump and a nozzle and squirting the liquid, the mixed liquid, into your vagina in an attempt to cleanse your vagina. This process may remove or alter the natural mucus, the natural secretion on your vaginal wall, and may lead to vaginal dryness. Let me quickly just drop this here. Your vagina does not need cleaning. It cleans itself. It's an organ that actually cleans itself. So this is the part where I mentioned that your vagina is different from your vulva. Your vulva is the outer part that consists of your mons pubis, your labia majora, your clitoris, the opening of your vagina. However, the vagina itself is inside. You can't see it except you use a speculum to look inside it. So the vagina is a hollow organ. It's what's inside, not the outer part. You can wash your vulva with just water or unscented soap, but you see your vagina, leave it alone. Don't stick your finger inside it. Don't attempt to wash it, because you could alter the natural mucus of the vaginal wall and it can lead to dryness, and it can also cause vaginal infections. So the take home here is that douching can cause vaginal dryness and lead to bleeding after sex. Chemicals in feminine hygiene products can also cause vaginal dryness. I've said this so many times in my videos. Stay away from feminine hygiene products. These products are marketed to make you believe that your vagina should smell like roses, lavender, strawberries, perfumes, and whatnot. But in fact, it is not true. Your vagina has a natural smell, a natural feminine smell, which is mildly acidic or no smell at all. This natural feminine smell is just fine. It's what makes you you. When you use these feminine hygiene products, you alter the natural pH of the vagina, and this can affect the good bacteria that is protecting your vagina and allow the bad bacteria to multiply, leading to infection. And these products can also lead to vaginal dryness, which causes bleeding after sex. Also, chemicals from detergents that you use to wash your underpants may cause vaginal dryness, and swimming pools also can cause vaginal dryness. Other things that can cause vaginal dryness includes childbirth and breastfeeding, certain medications like cold medications, asthma medications, some antidepressants, some anti-estrogen drugs, women that have their ovaries removed because of certain medical reasons, women on cancer medications like chemotherapy and radiation therapy, and lastly, women that are experiencing menopause, women that have reached menopause. The reason the vagina is naturally lubricated is because of a hormone called estrogen. When a woman reaches menopause, her estrogen levels decreases, and this contributes to vaginal dryness, leading to bleeding after sex. So this brings me to the third cause of bleeding after sex, which is cervical polyps. Cervical polyps are not cancerous. They are like tiny growths that can be found on the cervix, which is the neck of the uterus, or within the cervical canal. So because they are not cancerous, we say they are benign. Simply put, it is not cancer. It's usually just a tiny growth, but this growth can cause bleeding, especially during sexual intercourse. Also, there's something called cervical ectropion. It sounds like a huge medical word that sounds like one big diagnosis, but it really isn't. It's also called cervical erosion. It is not as bad as it sounds. It is simply a condition that occurs when the delicate cells that lines the canal of your cervix extends to the outer part of the cervix and onto the vaginal surface. Cervical ectropion is more common in women who take hormonal contraceptives, that is, hormonal birth control pills, or during pregnancy. The exposed cervical cells may bleed easily, especially during sexual activity. Trauma to the vagina or cervical tissues can cause bleeding after sex. Rough or vigorous sexual intercourse, especially without adequate lubrication, can cause bleeding after sex because it could cause small tears or bruises in the vaginal area. Additionally, certain practices or the use of objects during sex and result in trauma and bleeding. During sexual intercourse, it is important to prioritize communication, consent, and sexual comfort to minimize risk of such injuries. If bleeding is severe, it doesn't subside, or is accompanied by intense pain, my advice is for you to go and see your doctor. Lastly, and the most scary one, is cervical cancer. Vaginal bleeding is the first noticeable symptom of cervical cancer. The bleeding usually occurs after sex, and you would usually notice bleeding after sex before any other symptom. Other symptoms include pelvic pain and pain during sexual intercourse. Remember that although bleeding can be alarming when you see it after sexual intercourse or during sexual intercourse, it is sometimes related to minor issues that can be addressed with the proper guidance. But if you're unsure or concerned, it is best to see your doctor. It's best to consult your doctor. Your doctor will give you proper diagnosis and a treatment plan. If you found this video informative and you want more content like this, subscribe to my channel, like this video, share with your friends, drop a comment in the comment section below, and see you in my next video.